Welcome. Among the bones of the upper limb, we are now studying the scapula. First, we will clarify its position, then we will go through the important structures on the 3D model. The scapula is a flat, triangular bone on the posterior wall of the thorax. At rest, it lies over the 2nd to the 7th ribs, approximately 3 cm lateral to the midline of the spine. Its medial border is nearly vertical, rising slightly obliquely toward the superior angle, while the inferior angle points sharply downward. It articulates only with the clavicle and the humerus. Otherwise, its position is maintained by surrounding muscles. Let's begin with the acromion. This is the continuation of the scapular spine, a flat projection that extends laterally and anteriorly. Its superior arch curves above the glenoid cavity, and its end articulates with the clavicle at the acromioclavicular joint. Next, let's move to the body of the scapula, the main plate of the bone. Here we distinguish the anterior and posterior surfaces, which we will show separately in a moment. On the superior part of the anterior surface, laterally, arises the coracoid process. It projects forward and slightly laterally, several muscles and ligaments attached to it, making it essential in suspending the shoulder girdle. Beneath the scapular notch, the program here refers to the glenoid pole of the shoulder joint. This area is formed by the glenoid cavity and its surroundings. The neck of the scapula is the narrow constriction of the articular portion, on which the head of the scapula rests. At its end we find the glenoid cavity. If we turn the scapula forward, we can see its anterior surface, the costal surface of the scapula. Here there is a single large depression, the subscapular fossa, containing strong bony ridges, the so-called muscular lines, which are shaped by the pulling force of the subscapularis muscle. At the tip of the triangular bone, the inferior angle is visible. It points downward and serves as an important landmark. Laterally, at the articular pole of the shoulder joint, lies the lateral angle. Here, on the neck, sits the glenoid cavity. The lateral border is thick and rises obliquely upward from the inferior angle toward the side. The medial border, closer to the spine, runs almost vertically and ends superiorly at the superior angle. Now let's turn to the posterior surface of the scapula. This is divided by the scapular spine into 2 regions. Above is the supraspinous fossa, and below is the infraspinous fossa. Next, let's look at the superior border of the scapula. On its medial part there is a deep notch, the scapular notch. Lateral to this arises the coracoid process. Finally, the superior angle is located here, the upper endpoint of the medial border. On the edge of the acromion there is a characteristic point, the angulus acromii, the angle of the acromion. On the medial, anterior surface of the acromion we can see the facies articularis clavicularis, the articular surface for the clavicle. If we turn the scapula laterally, we can see the cavitas glenoidalis, the glenoid cavity. This articulates with the caput humeri, the head of the humerus, forming the articulatio humeri, the shoulder joint. The cavitas glenoidalis itself is a shallow, pear-shaped depression with a narrowing apex superiorly. Beneath the cavity lies the tuberculum infraglenoidale, the infraglenoid tubercle, from which certain muscles originate. On the posterior surface, below the spine, extends the fossa infraspinata, the infraspinous fossa. Running across the center is the spina scapulae, the scapular spine. It begins medially from a triangular base, gradually rises into a prominent crest laterally, and then continues into the acromion. Between the spine and the cavity there is a small passage, the incisura spinoglenoidalis, the spinoglenard notch. On the anterior side again, we see the fossa subscapularis, the broad anterior depression. Above the cavity there is a small but important structure, the tuberculum supraglenoidale, the supraglenoid tubercle. Finally, the area above the spine is the fossa supraspinata, the supraspinous fossa. To summarize, the scapula is triangular, its medial border is nearly vertical, the inferior angle points downward, and the bone lies over the 2nd to 7th ribs. The spina scapulae divides the posterior surface and continues into the acromion. Above and below the cavitas glenoidalis lie the tuberculum supraglenoidale and tuberculum infraglenoidale. On the superior border, the incisura scapulae is an important landmark. With this, you can confidently identify all the essential features of the scapula on the model.